then one day he turned up and he said, I have burning mouth syndrome. Can you help me? I was like, sure, let's give it a try. He gave me 2 research papers and both papers showed favorable outcomes using acupuncture for BMS.
End of the 3rd session, just had my needles taken out. I'm feeling very, very loose and very, very good in the base of my throat now. So it's fantastic. Some of the symptoms can be burning mouth, but also a very, very dry mouth. For example, you can't salivate, you can't spit. And on the worst days, it's honestly like you feel like you've been running, but of course you've done nothing.
What do you mean by running, but you haven't?
So imagine you've been running for a marathon, but you didn't drink during that marathon. Yes, that's what it feels like. You feel thirsty, you feel like there's no moisture in your mouth at all, and your lips are very, very dry. That's the sensation on a day-to-day.
And then you said something about Globus?
So another symptom of burning mouth syndrome is the sense of Globus. It feels like something is trapped right at the back of your throat, and you cough, you try to clear your throat a lot. People with genuine Globus, they cough and they feel uncomfortable when they drink or they eat. Right? Whereas the symptom went away when I drank and I ate.
Could you describe the specific left-right sensations?
Sure, okay. So at its most extreme, there was this one point at which the only way I can describe it was, imagine you have a muscle that is rooted here, and it finds its way up to your nostril, and it feels very, very tight, almost like there's a strong bit of string pulling, like that, and it was so uncomfortable. That was probably the worst sensation of them all, because that was, you know, whole days where you just feel like there was something just pressing here and here inside your skull.
Okay. He actually supplied me with the research, and I needled him mostly based on the research, and I'll talk more about the points we used. Let's talk through some of the points used. A lot of the points used have to do with the trigeminal nerve. So a lot of them are the stomach meridian points, and they go from here to here to here, and to here, and here, and here. And some of them map to certain anatomical locations. For example, this point is the mental foramen. There is the infraorbital foramen here. These 2 points associate with the mandibular branch of the trigeminal nerve. And then there were master points that were chosen. This point here, and then some points on the legs. And I used all of them. I also used some additional points on the ears to calm the nervous system, as well as these 2 points here that calm the nervous system. The outcome was favorably positive, and he's going to describe how he felt after the first session of acupuncture.
After the first session, immediately there was a much higher sensation of moisture in the mouth, whereas it used to be kind of thick and goopy and snotty. It became more silky, is the only way I can explain it. It still wasn't runny like water, more like a thin cream. That translated to a much smoother sense of Globus. So the Globus was still present, but it didn't feel as harsh. So I strongly believe that the lack of moisture and the sensation of Globus are interlinked. The less moisture you have, the far more fierce that Globus feels. So even now, just now having my second treatment with Dr. Chen, the first thing that I noticed was this sense that, this is going to sound dramatic, but the sense that I was kind of drowning. Like I literally felt like someone turned on a tap and there was this insane amount of water flowing into my throat. I struggled not to cough many times. After the first treatment, I noticed that I was coughing a wet cough, which is the first time in months. And yeah, those are the 2 things I've noticed the most at the moment.
After the first session, we took a week before doing the second session. And again, he said after the second session, he saw additional improvement.
Immediately right now, I definitely feel that the Globus is a lot less. One thing that I also noticed the last week was I can actually sustain a longer conversation. Before that, it would probably be, you know, only 2 or 3 minutes of constant talking, like if I was doing a presentation, where I would have to stop because my throat would be burning.
So this is quite encouraging. If any of you out there is suffering from BMS, please ASAP look for an acupuncturist where you are. So how was the 3rd session for you?
Very, very good. You know, the needle is, it feels a little less extreme, but the power and the current that I can feel in both my left and right is very, very strong. But definitely in my neck on the left hand side, I feel like jolts every so often, quite powerful. And it doesn't quite feel the same as a spasm, but it just feels like a sharp, you know, surge of something going through my neck. So end of the 3rd session, just had my needles taken out. I'm feeling very, very loose and very, very good in the base of my throat now. So it's fantastic.
So I hope this was helpful, and any of you out there suffering from BMS, please go and get an acupuncturist ASAP. What I tell people is just give it a try, 1-2 sessions. Let's hope it works for you. If it doesn't work, then just give it up, but at least give it a try. I have never met a BMS sufferer apart from the patient who came in, and it is useful, not just for me, for everyone else listening, to find out how your symptoms might be different than that of the patient I saw, and we can all learn together. If you like what I'm sharing, please feel free to subscribe and leave a comment below. Okay, the video's over, but for inquisitive geeks out there, there are 2 more bonuses for you.
Initially, what felt like a little bit of pressure at the back of my mouth was diagnosed as perhaps a fungal infection, perhaps a throat infection, which steadily got worse despite treatment. We had antifungals, we had antibacterials, gargle, that kind of thing. I have a history of neuropathy, nerve pain in my shoulder and my hand. And what transpired after some analysis was this pain would respond to Lyrica, which is a pain suppressant for nerve pain. The pain, there was several different ones, and they were all very, very interesting senses. You'd have like electricity in your teeth, a burning sensation in your mouth, and a very, very sore throat. But after analysis by ENTs, GPs, etc., there were no lesions. There was no evidence. Like, it wasn't even like the skin itself was very red. However, these sensations kept me from sleeping at night. After it came across that Lyrica had an effect, it then occurred to me that this was something to do with the nerve pain that I've experienced in the past, which is why I approached Dr. Chen again to help me with this.
One of the symptoms of BMS is called Globus, and in Chinese medicine, we treat Globus hystericus. And it's this feeling of a lump in your throat that you can't really spit out or swallow down. I have used Chinese herbs to treat Globus before, and it has proven helpful for some of the patients. So I suggested to this patient, perhaps we can try using Chinese herbs. I don't know how effective it will be, but he was happy to try. When we treat Globus, the way different patients describe their sensation of Globus is always slightly different. But the big idea is that there's something that's discomforting in the throat, and it always feels better when we're able to take it away. For those of you who are interested, the base formula is called 半夏厚朴汤. The ingredients are here, 5 herbs. Of course, when I prescribe, we're using this idea, so I didn't use just the 5 herbs. I modified the formula according to how he was presenting and his sympathetic nervous arousal according to how I assessed him. I hope this video came in handy for you, and if you're a BMS sufferer, please leave some comments below.